In today's Family Focus, we're focusing on signs of autism. You can tell in the first 5 years of a child's life whether they are developing some type of disorder if you look closely. We're going to speak to a doctor in just a moment, but first, Carolyn Bruck shows us video and a story that every parent should see.
Go! Push. Good boy.
Meet 1.5-year-old twins, Nathan and Benjamin. One of them has autism. Can you tell which one? He's showing you signs right now.
Go!
90% of the brain's development happens during the first 5 years. It's why experts say it's the most important time in a person's life. It can also be one of the most confusing times for parents. That's where First 5 Fresno County comes in.
When it comes to parenting, it's a level playing field. Regardless of your education background or socioeconomic status, we all have the same struggles as parents, and we all really want what's best for our kids.
No parent wants to think something may be, quote, wrong with their child. But if something is, catching it early can make a dramatic difference.
Things such as autism can be picked up very, very early on, and why it's so critical is because the earlier the child gets that intervention and support, the more likely their chance of success is.
But you have to know what to look for. Let's go back to the twin boys.
Ready, set, push. Go! Push.
Were you able to tell which of these 1.5-year-olds is dealing with developmental delays? Pediatrician Melissa Aguirre says the signs are there.
This is nice because it shows you both, and you really get the contrast.
On one side, you see Benjamin.
There's vocalization, there's interaction, there's facial expressions.
As for Nathan,
there's not a lot of eye contact, there's no vocalization, and the train is not used the way it's intended.
Go! Push. Good boy.
We know from this that Nathan has autism.
Every step along the way, the first kick of the leg, clap of the hand, the first smile of recognition can act as developmental markers, giving mom and dad important insight. Because when you know what baby should be doing and when, you have the ability to do something about it.
90% of that brain is developing those first 5 years. They don't get a do-over. They don't get a second chance to go back. So we need to make sure that that foundation is being laid right in their little minds so that they can become, the successful kids that we know they can be.
All right, that was Carolyn Bruck reporting. And with that, we are joined now by Dr. Melissa Aguirre. She's a pediatrician with the Fresno County, California Children's Services. She's going to show us the red flags, tell us what to look for in the first months of your child's life. Welcome to the show, Dr. Aguirre. Now, this story really fascinated me because for the first time, I saw at least a difference there. But we're talking a 1.5-year-old. I mean, can you really, by looking at that and their actions, tell whether he's going to have autism or he has autism?
Those are some red flags.
Okay.
So there are some screening tools that you would go ahead and use if you were to notice that, or a parent would say, I'm concerned about my child. So that's a good start. So being the observer in the home is the very first place to start. And some of those things you can see early on. So you can look at eye contact. Does the baby make eye contact with you? Do they turn when you start to talk to them or you call their name? From 6 months to about a year, that's developing. And so if at a year they're no longer turning to voice, then that makes you concerned. Also, in sharing stories with them, babies will look at the story and then they'll look at their parent. It's called shared attention. Or they'll focus on the same object. And if you notice that they're not doing that, then that's concerning to you as well.
Okay.
Because that's that social interaction that's not developing in the way that it should be.
But I think a lot of mothers out there probably are maybe reluctant to tell their doctors that they might think this is a problem, because we don't want to be told we're just panicking. Don't worry, you're a first-time mom. It happens to all, they'll grow out of it. That's where we get stuck.
Exactly. And so that's why having some good examples of, well, I've shared this book with him and I noticed that he doesn't seem to be interested in it. Or, I have friends whose babies are doing this and I'm concerned. But even if you don't have any of those experiences, just stating your concern is important. And the screening tools are meant to be given to children who have those signs and who don't have those signs between 6 months and 2 years of age. So you can ask your doctor for that screening tool.
Should we push the issue if the doctor says, he'll be fine?
Most definitely. because you have an intuitive sense as a parent, and you need to follow that intuitive sense. It's so important to advocate for your child because you know your child best, and to seek out the help from your doctor, and if your doctor isn't listening, to seek out further help.
Another doctor, maybe?
Another doctor,
Wow,
or ask
okay.
for a developmental pediatrician. We have Dr. Snyder here in town, who's a wonderful developmental pediatrician and very happy to see patients.
Okay, so ask for a developmental pediatrician.
Exactly.
If your regular pediatrician says not to worry about it. Okay, so once we do this, I mean, let's just say now the child is 4 or 5 and you thought, oh goodness, I remember my child at 1 not really responding to me. Is it too late?
It's never too late.
Okay.
So although really the intensive therapy works best in the first 3 years of life, there are still things that you can do if you find out at 4 or 5 years of age. There's intensive therapy that can be provided to help children learn to socialize, to learn to communicate, and as soon as you get them into therapy, the better off they will be.
Are those services out there readily available for us?
They definitely are, especially for autism, but for other learning difficulties or language problems or social problems that might be similar to autism, they exist as well. Through EPU and CVRC are 2 organizations that are well known.
You mentioned EPU, but tell us exactly what that is, and I mean, is it an agency? It's Exceptional Parents Unlimited. What do you do there, and where can we find information?
At Exceptional Parents Unlimited, Dr. Snyder is one of the developmental pediatricians there, and there are lots of support services there for children with a variety of different developmental disabilities, from Down syndrome, autism, or even just sort of language delay. So they have some treatment services that are available depending on different criteria that you meet.
Okay, so that's Exceptional Parents Unlimited, and you mentioned another one.
And CVRC, Central Valley Regional Center,
Okay.
is also a resource. It's an agency that's state funded that provides support to children and adults with developmental disabilities. And there are different criteria that need to be met for those services, but they are a resource.
Well, thank you for that information. Very, very helpful, I'm sure, to all of the parents out there. We appreciate it, and we'll be checking in with you, I'm sure, in the upcoming weeks as we continue our series on Family Focus, which is just so great. I'm glad that we're doing this and that you are teaming up with us. Thank you, Dr. Geer, for being here.
Well, we appreciate you taking time to focus on children.
Well, thank you. Central Valley Today. We'll be right back. Stick around, folks.